Hi, I'm Dr. Neuhaus, owner of Neuhaus Foot and Ankle. I've been in practice for over 20 years. I've seen a lot of patients with diabetes, and they come in the office asking about shoes. There's a lot of information out there about shoes that a diabetic person should wear. I want to talk a little bit today about the Medicare Diabetic Shoe Program. So Medicare does pay for diabetic shoes under certain circumstances. This is an example of a diabetic shoe that we offer in our office. This is one of our more popular ones. People think diabetic shoes need to be these old black, heavy, clunky shoes. That's not the case. This is a really lightweight, nice tennis shoe. I've got another one. This is another popular model. It's kind of a slip-on, has a Velcro strap. Very soft material. Again, really lightweight. It's a good shoe. So who needs shoes like this? Not every diabetic patient needs a shoe like that. Most people can wear shoes that are just their every regular run-of-the-mill shoe as long as they fit appropriately. Patients that qualify for the Diabetic Shoe Program are people that have circulation problems. They have a deformity, meaning they have toes that are curled or a bunion, a hammer toe. They've got calluses on their foot. They have a history of an amputation. They have a history of a wound. So if you've had ulcerations, you're somebody that needs to have a diabetic shoe. The purpose of diabetic shoes is to prevent people from developing wounds on their feet, which will lead to an amputation. There's lots of research out there that proves that it works. If you have a good shoe with a good insert, and that's the other thing that we do is the insert. So a good insert is one that has cushion, it's custom fit to your foot. Some of the inserts, like this one, is just a slip-on. It's a generic, but it's really thick and padded. The shoes are a little bit deeper with a diabetic patient or a diabetic shoe. So the shoes are different, but not everybody needs that different shoe. So Medicare is very specific on who qualifies for the shoes. So if you're told by your doctor you don't need a diabetic shoe, that's a good thing. It means you're at a much lower risk for developing problems that could lead to an amputation. So that's just a brief overview of the Medicare Diabetic Shoe Program and who needs a diabetic shoe.